You're listening to the Business of Medicine podcast created by Mirazi. We are a medical co-working space located in Upper Hill, the heartbeat of healthcare in Nairobi.
Welcome back, guys, to the Business of Medicine, Kenya. Our one and only job, and I keep saying this, is to get all these fantastic guests together for you guys who've had these amazing or are having interesting journeys in healthcare within the industry, whether that be career-wise or business-wise, to bring those stories to you, to preserve them, and to share them. And if you like any of the content that we're putting out here, please show your support by liking, by subscribing, and by interacting with anything that we do put out there. Our guest today is Dr. Ilyaas Mohammed. I met this young gentleman. He's our first Gen Z on this show, actually. I met this gentleman about a month ago, I would like to say. He'd invited me on to the podcast. And the podcast is one that you should know by now. And if you don't know it, you're living under a rock. It's called the Laughing Labcoat podcast. When I met him initially and his team, because he'll tell us more about it, it's not just him. The one thing that really drew me to them was the hunger and the way of thinking and how they were approaching healthcare and medicine and how they were looking at business so differently through the lens of a podcast and a healthcare institution they were building. And he's here to tell us a bit more about that. Karibu sana, Dr. Ilyaas.
Thank you.
Introduce yourself to our people.
Yes, my name is Dr. Ilyaas Mohammed, co-founder Laughing Labcoat, co-founder Damal Healthcare, and hopefully I'll end up founding many more things in the future. Karibu ni asante. Thank you for having me here.
Karibu sana. So Ilyaas, you're a quarter of the group that you are.
Yeah.
And you have a very interesting genesis story, all working together, I believe, somewhere. All right, tell us how you guys got together and who's, you can shout them out.
Yep, definitely. I'll start by shouting out our host. His name is Dr. Mo. He was supposed to be here today. Unfortunately, the issues of running two different things at the same time is like one has to be put behind, one put on a different priority level. So Dr. Mo sends his apologies for not being here today. Behind me also is Dr. Hayat Mustafa. She is also our host at Laughing Labcoat. And Dr. Frida Ndwati. All of us are doctors that are running. It's a team of doctors, basically, as well as one of our other team members, our digital media manager. Her name is Mrs. Mahan Mohammed. So it's a close group of, I think the oldest is 29.
Okay.
And the youngest is 23. All of us are in healthcare. And we had this idea of coming up with a health app, an e-health platform, a physical space where we can offer our health services, and a digital space where we can talk about health in the most understandable way to our peers and people who are not even our peers, basically to everyone out there, and make healthcare not a very boring subject. Because healthcare is a boring subject sometimes, especially as doctors with big words. Sometimes even I remember zoning out in lectures because the presentations were usually boring sometimes. So making people aware of their health would require us doing it in a very non-formal way. Hence the name Laughing and the Lab Coat.
Do you think that's a generational thing about how you receive or process information?
100%.
Okay.
100%.
So that's changing like across the board?
Yes.
Okay.
If you are able to interact, I finished my studies in 2021 November. That's when I graduated.
Med school. Yep.
In Uganda. I studied in Uganda, Kampala International University. And from the time I graduated to when I started my internship, I was the first lot that was postponed. I had to wait out like 9 months. So you find I have 9 months of not doing nothing. I am a doctor. I spent all my time in uni. Uni did not allow me learn other skill sets here and there that could have made me get some money. So I remember being... everyone in the family knows you're a doctor, but you don't have any money. So I was working in a pharmacy as an M-Pesa shopper. And I was moving from South B all the way to Kawangware to get 600 shillings a day. And my transport was 200. So 400 shillings. And then I decided to look at my future for myself and for other junior doctors in Kenya. where are we gonna go if the situation is as bad as this for me now? Because I finished uni knowing in the time now that I was evaluating my future after having this 9 months out, I had to like kujita mkutano and be like, do you want to go down this path? Because my brother, when I'm doing this, my brother who was like 2 years ahead of me was also jobless now.
Oh.
So he was looking for a job here and there. Then eventually he got a job that he would work. We live in the same house. We share a room, but we don't see each other. Unapata?
He's a doctor as well.
He's a doctor as well. That is our host, Dr. Mo. And his work hours were 12 hours, 12-hour shifts. So it puts me in a position of wondering and asking myself, is this it for me? Is this the rat race that people talk about? Because you hear rat race when you're in uni, but you actually don't know what it's like. Then I come out and I have nothing to do, all this free time, and then now it dawns on you. So I'm like, okay, no way, I have to find a way out. And the one way out was starting to learn different skills. I started looking into videography and video editing, podcasting. I put a lot of effort in my gym career then. I learned about nutrition, especially calorie intake, output, and so on. So then I was able to get like an idea of where I want to go when I start my internship. Internship comes in and I see the same thing, that the doctors are not getting the money. The money is going to institutions. But the institutions, the spine of the institution is the healthcare workers. So I decided, okay, I have to follow the money. That is when I started looking into entrepreneurship and how I can have something of my own and enjoy doing something of my own with my people, you know? And then when I want to pursue further my medical career, I'll pursue it in a way that is not competitive. I'll pursue it in a way that is different in Kenya. So my goal is to be a sports athlete for Kenyan athletes. We don't have one that is purely Kenyan, that studied sports medicine, psychiatry, how to increase performance before, during, and recovery. We have physios here and there doing the job. We have people who have maybe done orthopedics and then moved into sports, but no one has done sports medicine as a discipline of its own. But before I get there, I have to find ways to finance my school fees. And how is that? If I'm very honest, I finished my internship last year, August.
Where did you do your internship?
I did my internship in St. Mary's.
Oh,
yeah,
good.
in St. Mary's, it helped me get like a business perspective of healthcare. And from then I decided I'm not going to work for any institution unless I'm working for myself first. If you look at this situation now of the interns being told it's a 40,000, where's the medical officer going to go after that? Private institutions will tell you we're giving you 100, we're giving you 90. I want school fees too. I want to build myself. I want to have things for myself. I want that car. I want the house. You know, I want the luxury travels once in a while because I feel like when I put in the effort that I do as a doctor, you need some time off to unwind and have those things. Although people will tell you like doctors should not have, there are people who still say like, as a doctor, where you're private, ufai kwenda kuonekana uko beach na shorts. Yeah. But it's a Gen Z doctor. I see my friends who are in other fields doing good. And I see myself who is in medical field being put down by the medical system, by the money in medicine, and I would say by institutions. As a junior doctor, it's really hard, by the way. I look at the people, I interact with people who are in universities, and I tell them, don't think you're just going to be a junior doctor and you're going to have a comfortable life that your medical career is going to sustain you. No. Get an extra skill set. Look into artificial intelligence in healthcare. And that is one thing which I started looking into. And I have a couple of friends now. Yes, you'd find they're okay with doing the locums and working 2 days a week and struggling to like liparent ya 15K hapa na pale, but he's learning artificial intelligence in healthcare. So that is where junior doctors and people who are in below internship level are. That is our school of thought.
Mm-hmm.
Some are going into data analysis. Some are going into just different aspects of healthcare that have not been occupied by the positions and our senior colleagues. So that is where our mindset is. So I wanted to incorporate that plus the business in healthcare.
Okay. I find it very interesting that you're a team of 6 doctors, right?
Mm-hmm.
And basically, you started a media company.
Mm-hmm.
Because that's what the Laughing Labcoat podcast is. It is a media company, if you look at it. I understand that you have your whole setup. You do the production. You do an end-to-end kind of production, right? Any of you outside of you, I know you said you studied by yourself, and I would be interested to know what exactly does that look like for the viewers who are listening. What does that exactly look like? Where do you get this kind of information to start a podcast? But also the other question is that, is there anyone else in the team who kind of went for formal learning in media and communications or that kind of
Apparently none.
stream? Nothing.
None. YouTube is our biggest teacher. Yeah.
Okay.
So
YouTube Academy.
YouTube is our biggest teacher. So on the video aspects, the videography, shooting, you just get a lot of content in from YouTubers who are dealing in such spaces. Then you try trial and error, because when we started, we had just like a very small M50 camera. Now we're at 3 camera pro mic stations. We're trying to evolve. We will evolve, but we're not only looking at it from the digital side. We're also looking at it, biggest way we are looking at it is artificial intelligence. We want to go big on artificial intelligence in healthcare because that's something people are not doing. But my peers have already started it. They are now into it.
Okay. Good. And then, like, how did you pick this team of 6 people? I know one of them is your brother.
Yeah.
How did you merge with the others? And there's a bit of an age difference, not much. It's about 6 years. But how did you select these people?
It's the vision, I think. It's the vision because my brother and I had the same vision from uni. We used to live together as well, so we had the same vision of setting up our own thing. But once you have people who also are out of the same thought and idea and are willing to put in the work and have the same work ethic, and they look at the vision, they see what I'm doing or what we are doing, and they be like, I'm cool with that, you know? And they are now able to buy into the idea that we're not getting any money now. But in the long term, we will not only think about money, but we will think about value now and in the long term, such that 6 years down the line, where will we be if we're able to sacrifice for now? So that is the biggest thing that has brought us together. The willingness to sacrifice and buying into the same idea. That is the one thing that has brought us together.
Tell us a bit about the podcast. It's like, what is it? Who's your like target audience? And looking at it in the sense of a business, what does that look like? What's the plan? Because a business at the end of the day has to put money on the table. Yeah.
For now, we're not even treating the podcast as a business. We're treating it as a way to get community, get people to know us. You'll never find me outside. I'm always indoors, either working on the podcast or working on the clinic. And I need people to be with. I need people to interact with. I need people to share ideas with. That's where the podcast comes in for now. For now, we're not even looking at it from any financial perspective or anything. We're only looking to get a community of people. So once we have our own community of people and we subdivide our community into people who are having, say, medical challenges, into people who are, say, like interested in the medical world because they have a family member who is suffering from something, or they have generally just want to hang out with us and see what junior doctors are doing. That is the community we're trying to build. And people who want to know the future of healthcare, that is the community we're trying to build. Then the money, will look at it down the line. We're not even thinking about it now. Now our biggest ever goal is to get a community.
Why did you call it the Laughing Labcoat?
Like I said, the medical world is sometimes a boring one. And when you want to deliver information, healthcare information, you have to there is a way you are taught sometimes you're taught, sometimes you're not taught. Like when you're delivering sad news to a patient, no one teaches you that. You figure out that one on your own, pole pole. When you're telling breaking bad sad news to someone that you have cancer, no one teaches you how to go through that. So the Laughing Labcoat now is basically to teach people about sometimes a sad world, sometimes a happy world, in a humorous way. That is where the Laughing Labcoat came.
It's an interesting name, I must say, and a catchy one for that matter. Okay. Great.
And so the last time I was there, and was sitting around with you guys, and at some point after we had finished shooting, we were just talking, and the conversations were very different from what the average doctors would probably speak about in the room. It was more about there was a hunger to learn something new, to learn something new about the business, to learn what you can do with this. There was also a lot of experimentation. Can we try this? Can we do this? Can we do? Where does that come from? Is it something that you guys have just developed over time? Is it where does that come from?
When I was doing rounds in this area,
yeah,
they call it a creative space.
Yeah.
So now we in our community, we're trying to promote creativity in the medical field. So everyone is a creative in their own way in our group. So we ask people come up with ideas, we build up the idea. Everyone has their own thing that they want to do. So we try and build up the idea together. And then in that way, making their creativity to flourish out there and to come out, bring out their creativity and associate that creativity with healthcare. But when we are doing this, honestly, if you were to ask me from a business perspective, being one of the co-founders and the executive officer from Damal, I'm scared, honestly. Like deep down. For a business, as a business-wise, I'm scared because there's a lot of things I am learning on the job. I have never been in a business school. When I was doing my first negotiation for the rent, for the equipment, I've never been in a negotiation school. I had to go pick up a book about negotiation to learn what the psychology of negotiation is like.
Yeah.
I don't know. I got to know the use of a KRA pin in my 4th year in med school. Now I am running a health center.
Yeah.
I need to file my taxes.
Yeah.
I need to create proposals. I need to create grants, write up grants and whatever. I need to make projects. I need to deal with the county people. No one has ever taught me dealing with the county, dealing with that, dealing with the medical board. No one prepares you for that. And so honestly, I'm scared. As a young business and medical entrepreneur, I am scared. And hopefully, inshallah, if God wills that, maybe through hard work and persistence, we're able to provide bread or maybe break even or even just stay afloat. Because we are very young. We are 2 months old as a business.
In terms of when you were setting up the podcast, again, it would be interesting to know. You mentioned that you were renting out equipment. Did you start out with renting or everything, or did you buy everything?
I invested my internship money
okay.
to the podcast. I didn't squander it because sometimes you had the going out once in a while, even went all the way to Uganda for Nyege, then came back. I was like, okay, now I have to invest in my future because I was like, you don't see a future ahead by going the normal MO route. So it's like, let me start a podcast, get a community. From the community, now you can have a selling base from the community.
Okay.
Yeah.
And I find it interesting that you picked a podcast. At that time, normally, probably an insurance guy came and told you to buy life insurance, I'm sure. And there are shares. Yeah, and farming and of all what are the things you explored and finally decided that maybe the podcast route would be for growing your community, like you said, maybe the podcast route is the way to go.
First of all, we looked at conventional advertising method, how much they cost. And I remember I called Royal Media, I called Standard, everyone, trying to get trade cards of how much do you charge for advertisements for a medical facility or anything medical. And I was getting 2 million shillings for one 1 minute and 30 seconds peak time. So it's like 2 million shillings. Your 2 million shillings ningefanya vitu mob. So it's like, okay, why don't I create my own? I'm seeing people in podcast space. Then I used to watch Joe Rogan, and I have my other. I'm a very big fan of Outlook podcasts. Usually talks about like real life stories. So I was like, let me just start my own. Probably I'll get a community from there.
Okay, that's interesting.
Okay. It's interesting how you're using. I like the idea of first creating the community, the base, and then figuring out now from that community what it is they need, they require, and then using that to now inform what your business looks like going forward. So with Damal, what does it stand for, first of all? Does it stand for mean anything, and where are you guys located?
Yeah, the Damal Healthcare is general outpatient, but focuses more on cardiac specialty. We are located along Tigoni Road, Kilimani. Our unique selling point is that we are using artificial intelligence in healthcare.
Okay.
And while using artificial intelligence, we end up lowering the cost of healthcare because we are cutting out some human resource. So, for example, I'll just give you where we are using our artificial intelligence. We're using it mostly to interpret our imaging. Specifically, we're using it to interpret echo imaging. But we can use it for, say, bronchoscopy. We can use it for, what's this other one called? Continuous glucose monitoring. And we're trying to bring it at an affordable cost to everyone who can access it. We had someone on the podcast the other day, whose name is Dr. Yashar. He's our lead specialist. He's a guy who has been to war areas and so on. So we developed this model. This AI model was developed some time back, but we are outsourcing it. And we're among the first people to bring it to Kenya, actually. And in the normal interpretation of your heart and everything, sometimes you are always prone to human error. But once we are able to know that this thing works, is giving accurate results, got a QC control, had a study out of it, we started incorporating it in our healthcare provision services. And we found out that it is working. So we will not continue giving it at the higher prices that people get from there. So we leverage artificial intelligence to reduce the cost. That is our principle at the mall.
What has the uptake been? The reason why I ask this is JP and I had, at the time, many years ago, had a different business idea that we tried. And it had to do with 3D printing. And the uptake was horrible, if I say so myself. It was tough. It was an uphill battle. And a lot of it had to do with the fact that in the medical field, things don't move fast. It's not like in IT where there's new technology and there's a quick adoption and all those things. And there were many reasons for that, part of which was like the old guard or the established people were simply like, I do not see the advantage that this particular technology is offering me over what I routinely do. Or some of them would be like, no, this has just worked fine for me. I know how to do it this way. I'd rather do it this way. So I'm wondering, what has the uptake been in terms of incorporating AI? And right now you're saying in terms of imaging interpretation. What has that been? And are there other applications that you foresee in the near future?
For healthcare with artificial intelligence. The uptake, one thing that I have found common among patients who we have done this imaging services for is trust. There's some patients who come in just like a second opinion after seeing someone else, then come and see us and see, okay, is there any close relations to these things? Then when they find out that we give them similar information to what the previous doctor had told them, and now we give them the images, we actually give them images on their WhatsApp phones so that they can be able to participate in their care themselves. So they know, how does my heart look like? We show them where's the blood coming in, where's the blood going out, how much blood is staying, how much blood has gone out. We help them calculate, and they actually participate in the healthcare. So getting their trust is one issue, getting trust of patients. But we know that will build up over time. But artificial intelligence in healthcare, it's in Kenya, it's in baby stages. mostly right now we're using it in imaging, although we've had sit downs with Indian doctors who, I think the first ever like gig we almost got for Laughing Labcoat, which we eventually ended up being scammed by by the Indian guys, was they had come to talk about robotic surgeries and how they were having artificial intelligence in that robotic surgery present, and how this its precision is to the 0.0001 millimeter in terms of cutting. So that is when I got to know that artificial intelligence will come to healthcare. Then now it has come. We have started with imaging, but it's going to progress more. Even in terms of prediction of diseases, it will come. It will come, and as doctors and as patients, we have to be ready for it.
What does that mean? Like, how do we pivot? What does being ready for it mean? Does it mean increasing our skill levels, learning, or
learning it is one point, to a point where you'll have to find how there's a point where artificial intelligence will come in relation to plastic surgery, like for you. I don't know how you are able to, it can be incorporated now, but for people who are in imaging and prediction of diseases, even looking back to your genetic history, ancestors can be able to predict in how many years will you be having a new lesion or cancer coming in. It will come. So that is the side that I know more of and the side that I'm focusing on. But it's way broad and it's going to come.
From the discussions that you've had, and I'm sure you've been having these discussions with the people in the field and outside of the field, what do you think the reception would be? So, for example, I know like you joked about radiologists, but I know like there's that innate fear that maybe I'm being replaced, or I will be rendered redundant once this technology is figured out. And for that reason, perhaps there might be a lot of pushback. Do you think that is an appropriate prediction or an accurate prediction of what would happen if AI came in the field? Or do you think guys will receive it with open arms?
There'll be two scenarios. Scenario one is among the people who are going to welcome it first are the junior doctors. And this is people from internship going down all the way to medical university. Those people are going to welcome it very fast. The people who are probably going to have doubts on it are going to be medical officers and above. That is where the fear of replacement will be in those people. But for the younger ones, it will be a new avenue of learning, new way of seeing things, different kind of medicine, studying medicine. I cannot speak for the people above, but I know some people have started incorporating it, actually started accepting it. But the sooner as healthcare workers we accept it, the better. In a way, then you'll be able to know how it's going to augment you. It will not replace anyone, but it's going to augment us.
Okay. I mean, personally, I am yet to see how I use it in ENT, but maybe for us, when you're using it in terms of statistical models, we have, for example, patients who work in areas where they are exposed to noise pollution. So the only way I can think of, and I'm just imagining here, is the way I can think of it being used is if, for example, I work in an airport, then using AI, I can tell, for example, the companies that have employees in an airport, that if you employ this particular employee for the next 10 years or 15 years, the expected hearing loss is supposed to be this. And therefore, you need to insure yourself or cover yourself for the damage that they're likely to accrue because of the exposure that you've given them. That's just one of the ways that I can think of it being used in ENT. In plastics, perhaps, I don't know, if I want to look like Ryan Gosling, which I think I'm an African Ryan Gosling. If I want to look like Ryan Gosling, then I can get an AI model and then go to Dr. JP here to fix me up. Whether I end up like that is a different question altogether. But I can see how it would come to augment. But that's a different discussion altogether, I imagine. Yeah.
So that is our probably unique selling point at Damal. The name Damal itself is one that was given to us by our mom. My mom is someone who came in from the Somalia war and she moved into Kenya. But my dad was born here. So when my mom was coming, the first place she took shelter off from that was a tree with a big canopy.
Mhm.
And that's what Damal stand for. A canopy where people are and they find shelter. You know, zamani mgumo tree, wazee wanapatana hapo. So that is why we brought the name Damal. So to place watu watapatana. The community now is where it comes in.
Okay.
So,
the community.
Yeah.
Okay.
So the community were trying to look for place watu watapatana, place to tuona ideas ni gani, which ideas are going to work, which ones are we going to try push.
Yeah.
Especially as junior doctors in healthcare.
Yeah.
Hopefully we can be able to bring some slight change in terms of how healthcare is practiced in Kenya. That is, and also if we're able to like get this AI up and running very well, I think we can reduce the cost of healthcare.
Okay. All right. So AI is your golden goose, so to speak.
Yeah.
And your value proposition. When you guys, so you came back from Uganda, ukakosa kufanya internship, 9 months you were out, and then eventually you got in, and then you finished, and then you said you used that money to go to Nyege Nyege, and then build a podcast.
Yeah.
Damal, where did that money come from? How much did it cost to set up?
Well,
a rough ballpark figures. You did.
Rough ballpark. It's fairly a small clinic, so 10
million.
10 M.
Okay. So that would cover your rent, equipment, consumables, staff, and all that kind of stuff. Okay. All right. I know you don't make 10 million in internship. So was it kind of friends and family came together, as well as you guys, your own cash? Did you get financing?
Well, I'll say Alhamdulillah, which means thank God for my parents.
Okay.
Our parents were our biggest financiers in that project. Initially, before then, I was never even supposed to do medicine. But it's my dad who was a doctor, so I went the doctor route. So the goal was to be at the end of medical school, and I'm a doctor. I don't want to go start looking for locums and everywhere, because my brother had already done it for 3 years. Then I am coming in. I was like, I can't do that, because I know it's going to make me lose my creativity, and it's going to put me in a 12-hour shift box. So I want to go outside that box. So it's like, this is my investment plan. Sat down, wrote a whole plan, proposal, how things are going to go, how Damal is going to evolve. I was like, this is what I have for you. I need money.
Okay.
I need money to start this. So some bit of resistance from my mom's side, because she's our major investor. Because she knew that we don't know the business in healthcare. So it's like, you guys are young, and so I'm giving you this money. It's a huge amount of money, and you have any experience in business. So she was a bit scared for some time. I was scared then, but I'm still scared now. But I will still move regardless.
Yeah.
So we managed to get some funds from her, and that's when we started it. Like, the most important thing is just start. Zingine tutajulia mbele. So that is where we are at right now.
Okay.
We are still starting.
You're still starting.
Yeah.
And so there's the Laughing Labcoat podcast, and there's Damal. Are there areas of interchange between the two?
As per now, not yet. But we do get people who would come in from Laughing Labcoat, and they'd request to see some specialists who we bring on board. Or they'd want us to do more of like an detailed, in-depth analysis of a certain condition. So we do that, but then put the content for Damal.
Oh, okay. All right. So you guys do the marketing for Damal? No. Completely separate?
Completely separate.
Oh, okay.
Yeah. That is one thing a lot of people have advised us on, people who have I have interacted with, who have been in the digital space.
Yeah.
They have told me, separate the two. So we are finding it also hard to separate the two, because we are the ones in the two.
Both. Exactly. That's why I'm curious.
To go the same 4 people that are here, the same 4 people that are here.
Yeah.
No, the same 6 people that are here, the same 6 people that are here.
Yeah.
So you'd be like, do we listen to these people and separate the two, or we put them together and we go forward?
Yeah.
That is the dilemma we're in. But as per now, we are having them kando separate.
Yeah. Okay. What I like, especially on the storytelling side, is how you guys have done this thing where you can have a patient come into Damal, the clinic, get seen with whatever diagnosis it is they have, and then walk upstairs and give their testimony in front of the mic, and then walk out. Yeah, I find that very, very innovative. I don't think anyone has done that before. Yeah.
What we did to got the idea that how we came about with that is, especially when you're doing content and when you're doing healthcare, and you want to try to mix the two, is remove all barriers that you can think of. Eliminate all possible barriers to shooting content. So like, okay, if you're working there, we can also work upstairs. Yeah, so that is how it came to to help us in the consistency. That is how that scenario came about.
Okay.
I think you've not been there. Maybe you'll give us a visit sometime.
Yeah, I'll pay you guys a visit because I am finding that quite interesting. And exactly just the same way you're saying, the same 4 people or 6 people who are in the production company or media company are the same 6 people who come down and see the patients. And it becomes like it's seamless. Really, you can't tell the difference between the two. But I'm also interested in knowing what's the kind of structure you have, if you're able to divulge that information for us. What's the structure you have, organizational structure you have for the Laughing Labcoat and Damal? What does that look like?
So in our team of 6 people, I will start with my brother, the host. So for Laughing Labcoat, he is the host. He is the face of the podcast. The script is usually written by Dr. Frida. Then we have, because when we were starting it, we were only guys. And then our audience is more female. And they were like, gender equity guys. Forgetting principle number 1. Like, okay, we got a friend of ours who we're actually in the same uni. Her name is Dr. Hayat. And then she came in as a host. And now we had the female host and the male host. And then we were also Somali people. And our community is one of the most medically misinformed people out there. There's one video I saw some guy, because we were big on beauty. So I saw some guy who would take like certain product, put it in a blender, and then mix them and then sell them as super whitening cream. So we were like, yeah, we need to look at this also from the Somali perspective. And like the issue we addressed on the last episode, the FGM, was one that touched a lot of hearts in our community, especially the Somali community. We had a lot of people coming in and asking, how can we get more information on this? Where can we find this person? And that is the information our Somali ladies never knew. So someone is hearing reconstructive surgery for the first time, and they've been suffering for a very long time, because we were able to relay that to some people who probably will never have interacted with other kinds of healthcare needs. But the Laughing Labcoat host is my brother. Back to the structure you asked me. My brother as the host, Hayat as the host as well, Dr. Hayat. Then we have Dr. Frida Ndwati, who is a script writer. Then I am doing whatever Nick is doing.
The production.
Yeah, I am doing behind the cameras and everything. So that is the structure for the podcast. Then it comes to the structure of the clinic. So head of clinical services, our main doctor is my brother. He has more experience than us. So he heads the clinical services. Dr. Frida Ndwati does more of the administration. Dr. Hayat does not practice. She doesn't do any clinical services. So now I come behind the business side of it, the organization, meetings up with counties, investors, and so on. The legal aspects of it and trying to run the business. It comes now. That is my part now.
Okay, great. How long has it been again for Damal?
2 months.
2 months. 2 months. Oh my goodness, that's your little baby. Fantastic. And for the Laughing Labcoat podcast, 1 year.
Close to a year now.
Oh, great. How has the growth been for the Laughing Labcoat in terms of numbers, or however you decide to break that down?
Well, I can assess our growth in very different ways. I'll not start by comparing ourselves to any other podcast out there. But I remember when we were starting, we had 2 little plastic chairs and one small table with a 1 small camera M50. Ukipeleka mbali, you're out of focus. And then we did it in my mom's SQ in South B. Till now we have a space, at least we have 3-4 camera setup. We have Nini. So it's been a growth in terms of size of the team. There's been a growth in terms of like the viewership is, like I told you, medical talks are sometimes not the most interesting. I don't know if it's in a way, the way we're delivering it. We're still trying to find ways on how to deliver the medical talks. Like I told you, the feedback that we got was our podcast is more for doctors. So you guys have to change it and make it more for everyone out there. So that is an aspect we learn on the job. But now we have 1.2K subscribers. Yeah.
Oh, fantastic.
And 51 videos.
51 videos. Wow, in 1 year.
And then we had a lot of barriers to production, but now we are still not yet set. Our aim is by the end of the year we have reached 100.
Okay. Oh yeah, we've just started Quetta 3. Okay. I think you might actually get there.
So I know you've said that the Laughing Labcoat isn't a business, at least for you guys. But when you look at podcasts and healthcare, what is the opportunity that exists in terms of this being an actual business that somebody can make a living off of? Yeah.
We went to this medical expos.
Yeah.
And I met with the African director for Mindray. And when I told him of what we were doing, he was actually like impressed and was like, you guys are doing this and you guys are doctors, yeah. Like, and he was like, down the line, if you guys continue growing, we'll give you sponsorships. You know, so that is one. Sponsorships with manufacturers. That is one, where we can review their products. We can also educate people about their products. That's one avenue of making some money. Then there is also local business people who have actually approached us to like advertise for them out there, put their products or their company information out there on the podcast. We're an online, we can call ourselves an online medical med rep. Yeah, an online med rep.
It's true.
Yeah, so those are the avenues that are there. Yeah, but I think usually sometimes the numbers are an issue. Sometimes the numbers are not an issue to some people. Some people, they look at the quality of information and the quality of viewers that you're having out there. If you find that we're having, say, 1,000 viewers and over 200 or sometimes 20 people who are like commenting consistently. So if from the 1.2K subscribers that we have, 700 usually are always watching every video we put out there.
700?
Yeah. If not on YouTube, they're watching it in other platforms. And they usually interact, they usually give a feedback. And they usually, every time we put out the content, they support it. And it's actually because of them that we are doing, we get the morale to keep doing this. Not ati tunajibamba. So hata kama we have no content idea, one community member would go like, yo, by the way, tell me about this. Like, okay, we have a podcast coming up.
Okay. And have you gotten to that point of, how do I call it, of kind of self-growth in the sense that every episode gives birth to the next? Do you think you're there yet?
No.
Not yet.
Not yet.
You're not yet getting calls out for who you want as a guest, or rather what your audience wants as a guest.
We do.
Or topics to discuss.
We do. But we are closing to Mefika episode 20. We are taking a break now. In this break, we want to restructure. This is where now we want to call ourselves to a meeting and like see the kind of content we want out there. So that we're dividing our content into corporate content and informal content. The informal content usually sells more, usually gets more viewers than the corporate content. So we are now looking into restructuring, planning episodes with playlists, not just like an episode. No. We get a playlist, say like the one we did on plastic surgery. And today we talk maybe about FGM, tomorrow we talk about some other things, tomorrow about some other thing. Yeah. Like that. That is how we are structuring, we want to structure moving forward.
Okay. There's something that you said it twice. And it made me very uneasy. And I'll tell you why it made me uneasy. You talked about failure and this constant fear that you have of failing. I remember just before the time we started doing that 3D thing that Alan was talking about. And this is my own personal story. I'd gotten past up. I'd failed quite a bit at that point in time before we went into this other thing. And at that point in time, being able to break that fear of failure, it kind of like removed a veil, which to me opened up so many things that I was then able to do and experiment, including the 3D printing thing, which, depending on how you look, it didn't work out. All right, it failed. And I wanted to ask you what you're afraid of, specifically when it comes to failure, and if that's something that you can kind of jump over.
I'm not afraid of the business going down.
Okay.
But I'm afraid of failing myself.
Mm-hmm.
Usually I have a lot of huge expectations off of myself because I pushed for mom to put all her money on my idea.
Yeah.
That is the only thing that is on my mind. The business not picking, I don't care about that. I will learn a lot from it. Even the now small business I have started, I have gotten some people actually wanting to be investors already because the vision. So my biggest scare is the vision not materializing, not the business failing. The business can fail maybe and I'll start it again, or I'll find another avenue for business to start again. But the vision, me to lose vision and me to lose focus and me to lose where we want to go as Damal. And if I lose that vision, that is the most scary thing.
And following up to that, I read somewhere that if your dreams don't scare you, then they're not big enough.
I had that from
If your dreams are not big enough, then if they don't scare you, they're not big enough. So then my question becomes, then probably part of the fear that you have is probably because you're a very big dreamer. Are you able to share part of the vision that you have for Damal? Where do you see Damal like in 20, 50 years, 100 years from now?
50 years, I see Damal as one of the biggest hospitals in East Africa that has an artificial intelligence in healthcare training center. And this is a challenge basically to people of my age, especially those who are young. Let's join artificial intelligence. Let's try and see if we can become the hub of AI in healthcare in Africa for a start.
Yeah.
So if you ask me when I close my eyes in the morning before I sleep, when I wake up, that's the only thing I see. I see Damal as having huge structure with a lot of inpatients, outpatients, centers, then leveraging AI and making healthcare at an affordable cost. That is where I see Damal.
How about Laughing Labcoat? Do you think you're going to be like Royal Media Services?
I know.
I kid, but yeah, like where do you see the Laughing Labcoat in
I
20
think
years from
similar
now?
to where you guys are wanting to take this business podcast to, business of a healthcare podcast to. I've also dreamt myself interviewing people like, when they're talking about healthcare and anything healthcare in Africa, the first channel that goes to.
Yeah.
So this is a concept we were discussing with Dr. Rain. And I don't know if this can ever come into fruition, whereby we have just one channel that is only medical. Where in the morning we'll have someone talking about nutrition, in the afternoon, 10 a.m. breakfast we'll have Dr. JP talking about weight loss. We'll have you talking about rhinitis. Like we have just one medical channel that is continuously running 24 hours. We can be able to have like catalogs of procedures that were done in Kenya. Shoot the videos like one. Yesterday we had the opportunity to go and see a pericardiocentesis, and I was filming it with a GoPro in my head. So one of the fears again that I used to have in uni was when I go to do that first cesarean section. What will it be like? Will I forget what is this, what is that? And aside from you only learn these things when you go to the operating table. But what if I had that video of a certain professor or someone who was doing it one by one, and it'd be like, this is this, this is this, this is this, all recorded, all of them together, all surgical cases or all any kinds of procedures that are ever done in the country, in one big, in video format, in explainer format, one by one. Like a surgeon maybe taking you through, say, tonsillectomy,
Mm-hmm.
you know,
Mm-hmm.
removing your tonsils.
Mm-hmm.
And the surgeon tells you, see, this is that, this is that, this is that, but you're able to watch that on your screen.
Screen.
Yeah.
Okay. Sounds like a good dream.
As,
a good vision.
As we wrap up,
Yeah.
I wanted to kind of get a sense of the mood amongst your peers, your generation, in terms of career and business. Is it one of, I know this medical thing, I'm not going into clinical? Is it trying to explore different things, or is it let's go open our own businesses? Because for us, it was more of get into clinical, become an MO, become a consultant, work for a hospital, stay committed to it. So what's the mood, especially also with the past strike that we've just had? What's the outlook? How are people feeling on the streets?
One thing that I got to, you know, I sit and I think about such when I'm interacting with my peers. Not everyone has the privilege of having their mom give them cash to open their own place, you know. And some people, they can't do without, even if the government tells them we'll give you 90K, watakubali bado. Because that is their own, there's the only surviving, maybe the only breadwinner in Nairobi, wengine wako ushago. There are also that kind of doctors you have to look at. So there are those who are among the young people are committed to going through that route. And they are passionate about learning a certain faculty of medicine. Then there are the other ones who, like us, probably like me, will be like, I don't want medicine to be my only living thing. I want to have time off, like you were saying. You want to have time off to do other things. I call it ADHD in career. Because I want to be a chef down the line. I want to know how to cook. I want to know how to like become a good video editor. I want to be a doctor at the same time. I want to be a nutritionist at the same time. You know, an athlete at the same time. So there are those people who have like a lot we want to do, and then there are also the other people who only want to focus on clinicals as a passion, because it's a passion for them.
For if Laughing Labcoat becomes what you are envisioning it to be, you become like the CNN of healthcare, where in the morning you have the nutritionist and so on and so forth, the entire day. And it is paying the bills, and it's doing more than paying the bills. Would you consider quitting and by quitting I mean, would you consider not practicing medicine and fully pursue that path in media, which is essentially what it is, pursuing that path in media? Or what would that future look like for you?
That future for me would look like as a businessman. I'll stop even being inside Laughing Labcoat. I'll stop being inside Jamal. I'll be the business person behind the two, and I have my small sports physician career here and there.
Okay.
Yeah.
Nice. It sounds like a beautiful life where you just travel.
Hopefully. It's a long way for me to get that one, but like I have to put in the work. I have to put in the effort now.
Okay.
Yeah.
Asante sana. Asante, Dr. Thank you, Dr. Ilyaas. Thank you, guys. That was Dr. Ilyaas from the Laughing Labcoat. Be sure to check them out wherever you get your podcasts from. Thank you, Daktari, for giving us the opportunity to interview you today. What you guys do is amazing. I think one of the visions that we had as Mirazi initially was actually have a studio too. But we kind of banked that for a while to pursue other lines of the business. But we are truly inspired by what you and your team of 6 people are doing. We truly wish you the best. I know you guys will go far with your both the podcast and Damal. I know you'll go very far. Thank you guys for watching us and listening to us on our 7th episode of The Business of Medicine. Kindly subscribe, like, and share. It helps us get even more guests into the show. It helps us with the viewership. So please tell a friend, and share widely. Thank you, and see you in the next video.